Hey, somebody came in with October is Breast Cancer Awareness Month, but it happens to be the Chicago Marathon Month. I'm wearing my Mylar heating sheet that they usually hand out at the Chicago Marathon. Uh, these are great, by the way, but they're also environmentally damaging, so you have to get rid of them in the proper way. A guy came in to see me for pain in the Achilles. He came all the way from Chicago out to see me in the western suburbs. uh, he had just finished a 5K. He was training for it for a while. Um, Supposedly had a twist about 4 months ago and did okay with it. Just watched. Kind of got better, kind of didn't. At one point in time in this whole 4 months, there was one point when he was actually pain free, but it only lasted for about a week. And then he did something and had a problem again. But this time it was not just the ankle, it was the Achilles tendon. We do not mess around with certain tendons. Biceps, patellar, and Achilles. The Achilles is a problem. Yes, because it's so tight and it's at the basis of locomotion for most human beings. The Back in the 70s, I believe we used to have a lot of Achilles tendon disruptures from surgeons or doctors injecting the tendon with steroids, not knowing that you would actually weaken the tendon and take away a lot of discomfort. So if you don't have discomfort, you'll go ahead and do a lot of damaging activity. And if your tendon hasn't healed up, pop, then you're in a cast after surgery for about 9 months, I believe. So what we usually do, at least in a sports medicine, integrative medicine slash Chinese medicine kind of way, is to first do no further harm. So I immobilized my friend and I put him into a posterior mold, essentially a splint that kept his ankle at about 90 degrees. That way it puts a little bit of a stretch into the Achilles while he's waiting to see the orthopedic guy, and yet it doesn't put too much strain on it. If you have the ankle at 90 degrees, then it puts a little bit of a stretch on. If this is the foot, for example, this is the heel, this is the Achilles, you'll put a stretch on the Achilles so it doesn't get too tight, as in letting the toes hang down. If this is the toes and the heel and the Achilles, if you let the toes hang down, your Achilles will be short. It'll be almost impossible to get it up like this. Getting it hyperflexed is not good either because you're stretching out the tendon too much. So 90 degrees is fine. No further weight bearing is fine. Crutches are fine, at least for doing no further harm. The other option is to improve on nutrition. So I stay away from dairy. I try to push fluids. Most of Americans are dehydrated. And then we work on nutrition. I think it's important to include fish oil. Fish oil is a natural anti-inflammatory. It'll offset a lot of the omega-6 oils that we get in processed food. Again, pro-inflammatory if you have high omega-6, anti-inflammatory if you balance out omega-3 and omega-6. So increase omega-3. Fish oil, krill oil, maybe flax. Number 2 would be to get into turmeric. I'll put a link to turmeric down here. I love the use of turmeric. I think it helps with joints. You just have to balance it out and make sure there's pepper as an active ingredient in whatever turmeric product you're using. It has to be a capsule. Sprinkling turmeric on your food isn't going to be enough unless you use a couple of gallons of it. Magnesium is also important. I do believe I have a link to magnesium. If not, hey, as long as your kidneys are okay, magnesium, 400 milligrams twice a day. The biggest side effect of that, usually, unless you have kidney disease, the biggest side effect is diarrhea. So if you start getting diarrhea, back off. Magnesium helps with a lot of muscle relaxation. In fact, in the emergency room or in the operating room, back when I used to deliver babies, if we have ever had a problem where the uterus was overstimulated, we would relax it with 2 grams of magnesium sulfate through the IV immediately. You can actually do that for a heart that's going into a death spiral by a fancy abnormal rhythm. It responds. In fact, the treatment of choice is magnesium. So magnesium relaxes a lot of different muscles. It'll definitely relax the calf muscle in the case of the Achilles tendonitis. There's also other things to use, turmeric, magnesium, glucosamine sulfate if there's an injury to the joint, but usually the Achilles goes from the muscle, the gastrocnemius, and the soleus down to the calcaneus, the heel bone. So I don't think glucosamine sulfate's that great. Topical medicines are very important. Whether you use a topical medicine in the form of an anti-inflammatory like Pennsaid, that's a prescription only. Sometimes you can get Voltaren gel from Canada without prescription. Then if you don't have or can't afford that, or you want to go natural, then I like helichrysum. Helichrysum, tea tree oil. Sometimes you can use other homeopathics. Traumeel is a homeopathic that works nicely. If you go in the realm of physical therapy, they'll use ultrasound, they'll use steroids through the skin at low dose, sometimes even electric stimulation to relax the muscle. Finally, acupuncture. I think it works great. Just have to find the right acupuncturist. Find the right acupuncturist to help you that knows about sports medicine and nutrition. And then getting into rehab. I think it's ultimately important. That's the only reason I send people to orthopedic surgeons, is just in case it pops, or on MRI we find a pop, or a lot of, it's called tendinosis. They can help clean up and debride the tendinosis. So if you have fresh, healing, ready to heal skin, tendon, muscle, that usually is not necessary. If the surgeon has to be called in, then great. But most surgeons at least have a physical therapist they work with that you can usually get hooked up with immediately and start in the rehab process. Because most likely if there's a tendon that's tight, there's also going to be a hamstring that's tight, a glute that's tight, a piriformis that's tight. It usually goes without saying. In the case of my young guy, he had what I thought was an ankle that was loose. A peroneal tendon that was also triggering or spasmed because of the ankle because of the ligament in the ankle, the ATFL, being torn. I think his peroneal tendon was asked to do more work, and then when he gave out on the peroneal tendon, the Achilles said, I don't want to do any more either. So he just had multiple failure of a whole bunch of stabilizing muscles. You see, it's important to know the dynamics of physical medicine in addition to Western medicine. So in this case, we've hooked all three together. We know the dynamics of what to do with Western medicine, physical therapy medicines, physical medicine, sports medicine, and then traditional Chinese medicine and nutritional healing. So this is how I would expect my athletes can maximize on the healing powers of what they have innately, in addition to kind of compressing the time frame of healing. The anti-inflammatory lifestyle is what we always shoot for, whether it's a heart disease that we're trying to avoid, cancer we're trying to avoid, or just an Achilles tendon that we're trying to get out of danger. Whether it's torn or not, it's just a matter of getting it back to functioning.